So the most common misperception that bariatric patients have is the fact that it doesn't cure their emotional or their head hunger. So that's something that we really want to stress with patients, that the surgery is only a tool. It does change their physical nature of their body, but they need to work on the mental aspect of it. They need to be able to identify what their trigger foods and trigger environments are before surgery so that they can control those and be able to be successful after surgery. Because there's always going to be that tempting aroma or that, free cake or, free lunch catered at work, and you have to learn to deal with that situation and be able to stay on track and keep progressing with your weight loss. So that's definitely the biggest misconception that patients express to us. The most common question that I hear is, will I ever feel hunger again? And if you do everything that we say to do it in the education book that we offer you before surgery, and you follow all the guidelines, and you eat appropriately, and you take your vitamins and your protein supplements and get the activity that you need, usually you won't feel hunger for about anywhere from 9 to 12 months, maybe even years after surgery. So that's definitely the biggest question that I hear is, will I ever be hungry again? So if you do what you're supposed to do, you most likely may not feel hunger ever again, or it might be a few years before you actually get to that point. So that's why it's so important to control your cravings and be able to control that head hunger aspect of it so that you don't eat when you're not physically hungry and not regain any of that weight that you've worked so hard to get off and keep off too.